Hi, I'm Dr. Dean Mammales from Cobblestone Chiropractic and Wellness, and welcome to our online healthcare class. First, I'd like to thank you for taking the time out of your busy day to watch this video and learn a little bit about what chiropractic is and what it is not, how it compares to the medical paradigm and how it doesn't compare to the medical paradigm. Chiropractic is very different. We take a proactive approach to healthcare, whereas the medical approach is taking a reactive approach or a symptom-based approach to healthcare, two totally different things. And also to talk about the different phases of care that you're going to go through your corrective care program. But before we get started, I'd like to tell you a little bit about myself and how I became a chiropractor. When I was 16 years old, I was a wrestler in high school and very active with sports, baseball, football, basketball. I was a black belt. And when I was wrestling, one of the captains in practice, he decided he was going to hold me down on the mat, face down with my chest on the mat, and he took my lower back and twisted it like that. And when he did that, I felt every vertebrae crack from the base of my spine all the way to my neck. I couldn't breathe. I couldn't walk. And back then in the early 80s, my coach didn't let me out of practice and pulled me to the side and on the side of the mat, and there I stayed until practice was over. My friends took me back home to my house, and my parents took me to the hospital. And at the hospital, one of the doctors there that I saw sent me to go see an orthopedist. And so the next day, my father and I went to see this orthopedist, who it turns out was the New York Giants, my favorite football team, their team physician. And I remember walking into the waiting room, and there's all these Giants football helmets all over the side of the wall with all these autographs on each of them. And I'm sitting next to one of my favorite players, Harry Carson, in the waiting room, and literally felt like I was in God's office, okay? And so when we got into the consultation after he had taken x-rays on me, he told my father that your son is going to need an operation. It's an extensive operation because he has scoliosis. We're going to put in a titanium rod in his back from the base of his neck all the way down to his lower back. And told me that I would not be able to participate in any sports. So there went karate, there went wrestling, baseball, football, basketball. There went basically my whole high school career. And he said that your son needs this surgery because if he doesn't have it, he could become paralyzed. And I'll never forget those words. And so my father, told him he was going to take me for a second opinion before they made a decision, and he was going to go take me to his chiropractor because my father thought chiropractors were back doctors. And so the next day when we went to school, or when I went to school, I asked all my friends, what is a chiropractor? What's chiropractic? What are chiropractors? Oh, they crack your neck. They snap your back. They crack it. They pop your bones, and I'm thinking to myself, oh my God, that's what got me in this position now. I don't want any part of that, and when I went to this chiropractor's office, I remember the first thing that he told me was, that your body is a self-healing organism. And that, if there's any interference to your spine and nervous system, it's going to decrease your body's ability to heal. And if we remove that interference, which the other doctor already confirmed that you have, your body will do what it's naturally supposed to do. It's going to heal itself. And, at the time, it made sense to me. And when he laid me down on the table, I remember when he put his hands on me that he absolutely knew what he was doing. You could just tell that he knew what was going on with me. And I felt safe in that environment. And after a few weeks of care, I think it was 2 to 3 weeks worth of care, I went back to go see the orthopedist, and the orthopedist told my father and I that I didn't need an operation, that my body miraculously healed itself, but it had nothing to do with chiropractic, okay? And so here I am thinking, like, are you kidding me? Like, that totally helped me. And so that's when I decided long ago that I was going to become a chiropractor, teach people about chiropractic and what it is and what it isn't. And so welcome to healthcare class, okay? And so oftentimes I'll ask people, how do you know if you're healthy or not, okay? How do you know whether or not you're healthy? And the common response to this answer is, as long as I feel good. As long as people feel good, they think they're healthy. But that couldn't be further from the truth. You can have a blocked artery, you could have cancer, you could have diabetes, you could have a pinched nerve in your neck, you can have a cavity. You're not necessarily healthy. You're just not symptomatic yet. And you don't even know that you have cancer, heart disease, diabetes, or all those other things until the symptoms present themselves. And so oftentimes this is the way people view themselves, as whether or not they're healthy. Pain, problem, no pain, no problem. And again, that couldn't be further from the truth. So, you know, Americans make up about 4% of the total population of the entire planet. But we as Americans spend 50% of all the money that's spent on medical care on medical care. And so we should be pretty healthy, right? I mean, we have the best doctors in the world. We have the best hospitals, best facilities in the world. Well, according to the World Health Organization, the US ranks 37th in world health. 37th, okay? So that doesn't make any sense considering we have the best of everything, yet 37th in world health. So something is wrong with our paradigm of sick care or reactive care. And so let's take a little closer look at that. And so there's something in the body called homeostasis. And homeostasis is your body's ability to maintain a state of balance or a state of ease. And there's an ease to the body. Homeostasis is controlled by your body's inner wisdom, which is called innate intelligence or your inborn intelligence, which runs the body. You don't tell your heart to beat or your blood to flow or your hair to grow or your skin to make new skin. It just does that. And that's what homeostasis does. It maintains a state of balance to the body. So if your blood pressure goes up, your blood, you run across a field, your blood pressure is going to rise, your heart rate's going to increase, your breathing's going to increase, you stop, it starts to slow down. There's a state of balance to the body. And there's something in the body, when the body is under interference or when there's a stress to the body, there is a dis-ease to the body or an imbalance to the body. And any breakdown or interference causes the body to move toward a state of dis-ease or imbalance. And the most epidemic cause of dis-ease or imbalance to the body is vertebral subluxation. What vertebral subluxation is misaligned vertebrae. The reason why they call it a subluxation is because sub means less than, luxation means dislocation. Okay, so have you ever seen somebody that has dislocated their arm? They're usually in a tremendous amount of pain, okay? So even though a subluxation is less than a dislocation, it's actually worse than a dislocation because we're dealing with the nervous system or the spine, which controls everything in the body, which we'll get into. All right? And so when dis-ease or imbalance is left uncorrected, we move toward a state of disease. And so you can take any number of diseases and trace them back to an imbalance in the body, like cirrhosis of the liver, for instance, okay? Imbalance of the body occurs drinking alcohol. Somebody's drinking alcohol, constantly drinking alcohol, imbalance to the body. Eventually, the liver starts to die, and we call that cirrhosis of the liver. But it starts out as an imbalance to the body. So anytime there's a condition of an organism that causes the loss of health or the loss of the body's ability to adapt or a loss of balance, we call that a disease. It can result in a variety of symptoms and destruction of normal body function, okay? And there's different health factors that determine how healthy a person is. There's genetics, there's lifestyle, there's occupation, there's environment, and then there's a past history of trauma and disease. We're going to take each one of these and break them down a little bit. Anytime I talk to somebody about health, they always bring up the fact that, of genetics, okay? Well, I have a predisposition to osteoarthritis. My father had osteoarthritis, or my mother had this, or my dad was a diabetic, so I have diabetes. Yes, you can have a predisposition to or a weakness to a disease or a condition. However, the gene doesn't always express itself. In fact, knowing that is a good thing because you can make different lifestyle choices so that gene doesn't express itself. And so just because somebody has a genetic predisposition to something doesn't mean they're going to get that particular disease, okay? It's a good thing to know, but it's not necessarily an end-all be-all. Next is lifestyle, which is a very, very big one. And there's a lot of things that go into lifestyle. The way you eat, how you adapt to stress, the use of prescription drugs and non-prescription drugs, whether or not you get a sufficient amount of rest, a mental attitude, positive or negative, and exercise and physical fitness. So let's take each one of these. So nutrition. Well, the American Heart Association released its latest dietary recommendations and said that, if you eat less processed food and more stuff that comes from the earth, like fruits, vegetables, beans, whole grains, and fish, that will help most Americans prevent heart disease, high blood pressure, and stroke. Whereas if you make the other lifestyle choices and eat processed food and eat bad things that go into the body, those things increase. Excuse me. Okay, and so how somebody adapts to stress, okay? There's type A personalities, there's type B personalities. Type A personalities function in stress. Type B personalities, you throw them a monkey wrench and they go absolutely bonkers. Here's a study out of USA Today, which said that, which took a ratio of how women felt stress and tension by the end of the day. And so 8% said all the time, 21% said almost every day, 29% said once or twice a week, 31% a few times a month, okay? And 11% only a few times a year. Whatever the case may be, people feel stress from time to time. And that stress, depending on how you adapt to it, plays a significant role on how healthy a person is. Because stress is what causes imbalance to the body, which we'll get into. So the use of prescription and non-prescription drugs, I can clearly remember my father being told that he should take a baby aspirin, one baby aspirin every day for the rest of his life, and it will decrease his chances of having a heart attack dramatically. What the doctor didn't tell him is that the daily use of aspirin therapy ups the risk of brain hemorrhage. Okay, so the side effect is just as bad as what you're trying to prevent. Anytime that you're trying to make lifestyle choices with medication, there's always a side effect. It's a very, very dangerous thing to play the medicine game. I'm not saying that people should not take medicine, okay? If somebody has high blood pressure, okay, exercise, eat the right food, get enough rest, get sufficient amount of, have a sufficient amount of proper nutrition that's going into the body. You do all those things and you still have high blood pressure, of course, you're going to need to take medication. But you don't take medication in place of those lifestyle choices. And so for more than a decade, people have been taking aspirin every day with the misguided belief that they were safeguarding their cardiac health. Better health through chemistry has failed. All right? Do not play the medicine game. Make lifestyle choices first, and then, if necessary, take the medication that your doctor prescribed. And so mental attitude, this is a big one. A happiness lapse could put your health in jeopardy. Studies show that people with a more positive attitude live longer, healthier lives than people that have a negative attitude. These are the type of people that when they walk into a room, the plants start wilting, or you just get bad vibes from, okay? attitude is a choice, okay? A lot of times circumstances may or may not be able to be changed, but how you react to those circumstances may dictate, how healthy a person is, depending on whether or not that is positive or negative. And then here's a big one for chiropractic, and definitely me in particular. So there's a well-known link between depression and fatal heart attack, and it may be due to a lack of exercise. And so I remember when I was a little kid and I was watching cartoons. Before the cartoons would come on, Jack LaLanne used to have this exercise show, and he used to go through all these exercises and teach people how to live a healthier lifestyle. He'd give them nutritional tips, and then he'd always end with a positive quote of the day. He was way ahead of his time. And when he turned 88 years old, they gave him a star on the Hollywood Walk of Fame, and he did 88 push-ups over it. I know kids that are 20 years old, okay? They couldn't do 88 push-ups. This man was definitely mind over matter. And if you look here, look at these arms. I mean, this guy's nearly 90 in this picture. And I love this quote here. Godfather of TV exercise shows says, "Dying would wreck my image." One of the greats right there. And so exercise and physical fitness is definitely shown to have a positive impact on occupation. And some people say, how could my occupation dictate whether or not I'm healthy or not? Well, how you sit all day, how you lift all day, how you deal with stress all day, all has a big, plays a big component in terms of somebody's health. Next is environment. What is the quality of the water you drink, or the food that you eat, or the air that you breathe? All different choices that lead to a healthier or a not so healthy lifestyle. And lastly, a past history of trauma and disease. So every time that you have a repetitive injury or a repetitive stress on the body or in the body, your body will lay down scar tissue. Scar tissue is calcium. And what calcium is used for in the body is to strengthen the areas of stress. And so through serious injury, repetitive movements, or aging, you can lose the health of tissue, which may be irreversible. And so I'm going to stop sharing my screen for a second, and I'm going to show you the spinal segment and give you an example of scar tissue. And so here is a normal, healthy segment, okay? This is the disc space. These are the vertebrae. These are the facet joints. And that's a normal, healthy nerve. And there is your spinal cord. You get a serious injury or a repetitive stress to the body. People that lie stomach sleepers, for instance, that's a stress on the body. The head is turned like that for 8 hours a day. The spine moves out of alignment, subluxates, and the disc space begins to wear unevenly. Just like when a tire goes out of alignment, the disc will start to wear unevenly like a tire. The longer that stays like that and remains that way, your body begins to lay down calcium to protect the disc and the vertebral segments here. And if you can see that, that's what starts to happen. We call those bone spurs. And bone spurs, aka osteoarthritis or degenerative disc disease or subluxation degeneration, they all mean the same thing, but they all have to do with the body laying down scar tissue. This is irreversible here. We can stop the progression of this through chiropractic care, but when I see a patient like this, we can never get it back to normal. The key is catching it in this phase here and then getting it back to a normal phase here. All right, so I am going to share my screen again, and we're going to go on to the next slide. And so just like I went over spinal anatomy, there are the vertebrae, okay, which protect the spinal column, the spinal cord. Then there's the disc spaces, which are shock absorbers to keep the pressure off of each individual nerve. So when your brain sends a message down through your spinal cord, it goes out through the nerve that gets to where it needs to go at 100%. So let's suppose this nerve here, goes to my heart. And let's say I cut that nerve. What do you think happens? Well, what happens is your heart stops beating, and that'll cause death if I cut that nerve. If I put pressure on that nerve, or if I interfere with that nerve, that doesn't always mean that you're going to have symptoms, because like I said before, or I may not have said this before, but these nerves are only made of 10% pain fibers, which is why people don't usually feel when they have a pinched nerve in their spine. Most of this nerve goes to your organs and your organ systems. So if there's pressure on this nerve, just like when you step on a garden hose, less water comes out of the garden hose, less information comes out of the nerve going to your heart. So maybe your heart is functioning at less than 100%. So the key would be to getting the pressure off of that nerve so the body does what it's naturally supposed to do, like my chiropractor told me back in the day, heal itself. And so what's also connected to the spine are facet joints and muscles and ligaments, which provide movement to the body. So there's three functions of the spine, okay? Bear weight, provide movement, and to protect the nervous system. Anything that bears weight and anything that provides movement, bearing weight and providing movement, is subject to misalignment. I'll use the example of the front end of your car. Like I said before, when the front end of your car, which bears weight and provides movement, moves out of alignment, the first thing that happens is the tires start wearing unevenly. When that happens in the spine, which bears weight and provides movement, the disc space starts wearing unevenly, okay? And the last thing that the spine does is it protects the nervous system, which is the most important system of the body. And so the nervous system, let's talk about that. Your brain and your spinal cord controls and coordinates all the functions of all the tissues, all the organs, and every cell in the body. It controls everything in your body via the nervous system. So here are some facts. Your body is a self-healing and self-regulating organism. So you're not telling your body to control your heartbeat. If you forget that, you know, your body, your heart's still going to beat, your blood's still going to flow, your hair's still going to grow. Well, for those bald individuals out there, that might not be the case, but I digress. You know, so you're self-healing and self-regulating. You cut your skin, okay? Your blood is going to coagulate, a scab is going to form, and eventually new skin forms. So you are a self-healing and self-regulating organism. Another fact is that your nervous system, like I've said before, is responsible for coordinating and controlling the function of all tissues, organs, and cells in the body. And so if the body is a self-healing organism and self-regulating organism, and the nervous system controls everything in the body, it's the nervous system that controls the healing ability of the body. So interference to the nervous system will decrease the way the body heals itself and the ability for the body to heal itself. So removing the nerve interference is going to aid the body in healing itself, just like my chiropractor back in the day. And doctors of chiropractic remove nerve interference. Doctors of chiropractic are the only people on the planet, through the art of an adjustment, remove nerve interference. So there's different phases of care that you're going to go through, okay? There's two ways that people utilize chiropractic care, but there's really only one way to utilize chiropractic care, and that's corrective care. And so the three phases of care are to relieve. The first phase is to relieve or eliminate the pain or the symptom. And so 99% of the people that come into my office come in with some sort of a symptom, whether it's head pain, headache pain, vertigo, arm pain, neck pain, low back pain, sciatica, whatever it is, they come in with some sort of a symptom. Usually we're the last resort. And so the first goal when I see somebody like that is to remove or eliminate the pain, which generally happens pretty quickly. Next, we're going to adjust and we're going to start to correct the vertebral subluxation complex, or the misalignment. And by doing that, what begins to happen is you start to restore the integrity of joint function, you rehabilitate connective tissue, your body starts to heal itself, you balance nerve impulses, balance homeostasis to the body and restore balance to the body. You increase flexibility and immune function, very, very important right now. The nervous system controls the immune system, so a great immune booster would be an adjustment to the spine. and you maximize your health and your quality of life. And lastly, the third phase of care is maintenance, where we maintain the health of the individual at the level of a maximum improvement and allow your body to continue to adapt and heal itself. And so we go through 3 phases of care on a corrective program. So I always use the example of orthodontistry. If there's a girl who's wearing braces on her teeth and she's going to go to a dance on Saturday night, and there's this boy that she wants to see, and she's embarrassed that she has her braces on, and she tells the dentist to take her braces off, what's going to happen if we take the braces off too early? Obviously, her teeth are going to move out of alignment. The same thing is true with your spine. You stop care too early, as soon as the pain goes away, what begins to happen is your spine will move back out of alignment because there's a weakness in that area, okay? So let's say she keeps her braces on and her teeth begin to stabilize. And once they're stabilized, the next thing she has to do once the braces come off is she has to wear a retainer to maintain the correction that's been made. The same thing is true with chiropractic care. When you get out of the corrective care phase and move into the maintenance phase is the retainer portion of care. And so it would be foolish for somebody to go all the way through a corrective care program and not do maintenance. Maintenance is different for everybody, and it depends on your level of stress. So a jackhammer operator, for instance, probably has a higher degree of stress than, let's say, or physical stress than a librarian. All right, so the only way to know what a maintenance program is going to be for an individual would be to get them under care and see how well they can hold an adjustment. And once we get to maintenance and know the body and know your body, we'll be able to determine what sort of a maintenance program you'll be on. But you have to go through the first 2 phases of care in order to get to the maintenance level. Lastly, subluxations run in the family. Have you had your family's nervous system checked? So most people, you know, they've had their eyes checked, their ears checked. They go to once a year for a full physical. How full of a physical could that physical be if they never check your spine and nervous system, which is the most important system of the body? So I encourage everyone out there to have their family checked to see whether or not there's any subluxations in any of your family members, and get them corrected. The sooner we do that, the better. That doesn't always mean that somebody needs chiropractic care, but we always want to make sure we check before we even get to the symptom phase. And so one of the things we offer in our office is free checkups for family members. And so I want to thank everybody for listening and taking the time out of your day to go through this. I hope you have, I've answered all your questions. If I have not, write them down, shoot me an email, or when I see you at your next appointment, we will definitely go over that. And so thank you again. I'm Dr. D. Mammales from Cobblestone Chiropractic and Wellness. We'll break our backs fixing yours.